The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, don't forget to like the video and subscribe to the channel for support. CLEOCIN, which is in the group of anti-infective drugs used against infection, is available in capsules of 75 mg, 150 mg and 300 mg. The active ingredient of CLEOCIN is clindamycin. What is CLEOCIN and what is it used for? Clindamycin is used to treat a wide variety of bacterial infections. It is an antibiotic that works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for virus infections. Using any antibiotic when it is not needed can cause it to not work for future infections. How to use CLEOCIN? Take this medication by mouth with or without food, usually 4 times a day, or as directed by your doctor. Take it with a full glass of water unless your doctor directs you otherwise. Do not lie down for at least 10 minutes after taking this medication. The dosage is based on your medical condition and response to treatment. In children, the dose is also based on weight. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same time every day. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Here are some things to know before using CLEOCIN. Before taking clindamycin, tell your doctor or pharmacist if you are allergic to it, or to lincomycin, or if you have any other allergies. Clindamycin may cause live bacterial vaccines to not work well. Tell your healthcare professional that you are using clindamycin before having any immunizations vaccinations. Before having surgery, tell your doctor or dentist that you are using this medication. Older adults may be more sensitive to the effects of this drug, especially diarrhea that doesn't go away. Tell your doctor if you are pregnant before using this medication. This medication passes into breast milk. Consult your doctor before breastfeeding. Side effects of CLEOCIN include: with the use of the drug, nausea, vomiting, or diarrhea may occur. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was useful for you, like the video and subscribe to the channel for support. Share your views and experiences in the comment section. I wish you healthy days.